Let's get more on the situation in India right now. Talish Ray is a Delhi-based lawyer who has started a helpline assisting those in need of beds, oxygen and medicine, and she joins us now. Thank you so much for joining ABC News this afternoon. We know that India is being overwhelmed. Do you think the daily tally of coronavirus infections and deaths paints an accurate picture of what is happening inside your country right now?
Not really, no. No, it doesn't, because it is difficult to keep account, and there are reports that are coming in that a lot of the times, because of the issues around funerals and other things, as well as the fact that there is a government machinery that is completely overwhelmed, the numbers are not accurate, no.
How has coronavirus affected your family?
It came in as a tsunami. We should have been on a vacation right now. My concern should have been getting my school kids' homeworks done. It should have been to go back to work. It's not that. Right now we're here with a sense of fear. Every phone call brings in some news, whether somebody is lost or some worse still. It's the inability to be able to do anything because there is a complete breakdown.
Do you think it has now reached the point that everyone in India has lost a loved one?
I would say so, yeah. More than one sometimes. And it's not the loved ones that are gone, it's the ones that are struggling, the ones that are struggling to get oxygen, the ones that are struggling to get across to a hospital. It's those that break our hearts right now. I don't think we have time to grieve.
Tell me about this helpline that you yourself have started up. I believe you did just hear that people were in desperate need of some supplies, and you happen to know of some people who were able to give them.
Yeah, so basically it started about a week, maybe 10 days back. I'm not sure about exact time, but I'd say it was sometime. I've lost account of what days this is, right? But it started with people calling out for help across social media. Across WhatsApp, Twitter, Facebook, Instagram, all of these. And I was amazed as a lawyer that we had information coming in, but nobody was verifying it. And that's something that my profession teaches me. You don't utter a word unless you're absolutely certain that that is going to be there. And then a part of me felt that how does it help anyone if you have 200 numbers and you're a caregiver watching your loved ones slip away, oxygen going down by the minute. So it just started with a bunch of us getting together and saying, hey, can we sort of do one thing, sit at a telephone at a particular point in time. If we receive any call for help, source the data from social media, wherever there might be a lead, verify it, call up whether there's an availability of bed, is there an availability of oxygen, is the medication that is available, can you get Tamiflu there, sometimes even organizing calls between patients and doctors asking for help all around, but ensuring that whatever information that came across was absolutely accurate at that point in time. It takes a lot of time because you start with starting to look at all the data that the government's made available, then starting to call up hospitals, starting to ask oxygen vendors and dealers, starting to look at coordinating. But at that point in time, I think it does manage to get across some help to somebody who doesn't know where to look for help, because when you can see your loved ones, your family members, others getting in, you don't know who to call in a crisis because the crisis numbers are overwhelmed. The official crisis numbers are overwhelmed. So it is, I don't think I'm doing anything amazing. I don't think it's anything more than what any human-minded, human-spirited person would do at this point in time.
You must be hearing such stories of desperation.
Oh, I don't think it's a trigger warning. I don't think I want to repeat. I think, but the two times that I came close to a breakdown was when I heard a gentleman called and he said his oxygen was slipping, and I called him 45 minutes later to let him know that we're still trying, we're hopeful, we can get you a bed, but we can't get you an oxygenated, ventilated bed. And he said, no, my oxygen is now at 70. Then 45 minutes later, we were still trying, we still couldn't get across the bed, and he said, I'm sitting at 60, I can barely speak. By the time we got him the bed 4 hours later, I'm glad. I'm hopeful he's in a happy place, and I don't know what I can do. I don't know what I can do to reach out to the family because I have no words. It's stories like this every day. I don't think one should borrow trauma. I think it's good enough that we should keep everyone in our prayers rather than looking at these stories, because for every one such of these stories, and we get calls, we get 30 to 40 calls. It's not much by any standards, right? But if I can get 2 people across the line, just 2, that's all I look at as a target. If I get 2 people across the line, it's a good day. And there are days that I'm not able to get across. Not me, not my friends, not all of us who are manning this helpline.
You said before that you aren't doing anything amazing right now, but some people must just feel so overwhelmed or helpless by the scale of this emergency. What do you know of others similarly pitching in ways where they feel that they can help right now?
Oh, I think it's all over. You just have to, if you know anyone in India who has been in the sphere of being public-minded or is in any way an influencer, you can see it. The Twitter handles in India of personal people, the Instagram handles, I don't know, I'm not on Instagram, but I see it on Facebook. It reads like a scroll for help. This one's doing, that one's doing, and I see the way people respond to a call, because a lot of the times these information is not available even to us. A lot of the times in desperation, there may be somebody who has my number in Bangalore or Mumbai who may call me up, or Lucknow, where I belong to, says a call saying that, can you help me out? Can you get me an oxygen cylinder? Can you get me an RT-PCR test? And there are others that step in, and they step in immediately asking for help. So I think most people who are in terms of a human spirit today, you can't sit and grieve. You have to do something. You just have to do something. It's not right to sit at home and wait it out.
Do you blame anyone or any level of government for the situation India is in right now?
I think that postmortem will have to wait, but I think the future course of action is more important. I think our government needs to be, it needs to be future centric. It needs to have control. Today we're out of oxygen, we're out of viral medication. We're also going to be falling short, but tomorrow it might be something else. So there has to be future proofing for the government. This is not going anywhere. They need to think about the fact that there are super spreader events that are there. At the moment, I don't think that there's any time to analyze what caused it or what can happen. I think every minute needs to be spent, because there are people out there struggling to get a breath, and it's our responsibility to be able to help those out.
A number of countries around the world, including Australia, have pledged urgent supplies for India. At the same time, we know that India is producing vaccines for the COVAX initiative for low-income countries around the world. Do you think those vaccines should be diverted for Indians right now, given the situation?
I think what's important is to get I think the government has taken steps for that, in terms of the fact that from the 1st of May, people like myself who are under 45, perfectly healthy, are eligible for vaccination, over 18, of course. And I think it's just about getting that ecosystem in place. I think India has a vaccine mechanism which is very well established. We've run some very successful in the past pulse polio programs and other eradication in terms of that. So it would be able to get that out. But yes, I do believe that at this point in time, I don't think it's about national boundaries. I think it's a humanitarian crisis. It's not about whether one is in India or in Australia. And just a word to anybody who might be watching: if you know someone in India, take the time out, just give them a call, just ask them if they're doing okay, because a lot of people are not. And it always helps to hear.
Talish Ray, you're so right. It's been terrific to speak to you this afternoon. Thank you for being very honest with us, and we hope the situation improves quite quickly. Talish Ray, a Delhi-based lawyer.
Thank you for having me.